Okay, part two, joints, types of movements at synovial joints. So their specific terminology is going to be used to designate the movements that occur at joints. Movements are grouped into four main categories. Gliding, angular movements, rotation, and special movements is what we will be going over on the next few slides. So gliding is simple movement back and forth and side to side. There's no significant alteration between the bones, so you're limited, of course, in range. And right here with this picture was showing you with the intercarpal joints is showing an example of that. Next, if you look at this first picture here with the pencil and the desk, what happens here is you have a pencil that, of course, is standing in an upright surface on the desk. The pencil represents a bone, and the desktop represents an articular surface. So with a little imagination and a lot of twisting, pushing, and pulling, we'll demonstrate that there are only three ways to move the pencil. Consider them one at a time, gives a frame of reference for us to analyze the complex movements. If you look at the example of the pencil showing you the gliding motions, when you're holding the pencil upright without securing the point, you can push the pencil point across the surface. This kind of motion is called gliding, which is an example of linear motion. So you can slide the point forward or backwards, you can slide it side to side, or you can slide it diagonally. But however, of course, however you move the pencil, of course, the motion could be described by using two lines of reference, which refers to the axis. So one line represents forward and backward motion, the other is left and right movement. Next we have your angular movements. These are going to be movements so it's going to increase or decrease in the angle between the two articulating bones. So some examples of some of those we're going to go over on the next few slides are the flexion, extension, lateral flexion, hyperextension, abduction, adduction, and circumduction. So if you look at this example of the pencil on the desk showing you the angular motion, if you hold the point in position, you can move the free eraser end of the pencil, of course, forward and backwards from side to side or at some intermediate angle. So these movements which change the angle between the pencil and shaft and the desktop are examples of angular motion. Okay, so the first one we have here is your flexion and extension. And of course, both of these are going to be opposing movements or opposite movements. So flexion, of course, is when you decrease in the angle between the two articulating bones, such as bending the trunk forward, you're going to be decreasing it. But both flexion and extension usually describe movements at the hinge joints of the long bones of the limbs. However, they are also used to describe movements of the axial skeleton, such as when you bring your head forward or towards your chest, you flex the intervertebral joints of the neck. But you see this example, this picture, if she brings her arm upward, she's decreasing that angle. Okay, so she is decreasing the angle, so that is flexion. If she brings her legs upward, she's decreasing this angle here. Same with the head, bringing it forward, you're decreasing this angle. So extension is going to, of course, be the opposite, and I'm going to erase all my marks here first. So extension, what you're doing is you're increasing in the angle between the two articulating bones. So the flexion and extension, of course, are going to be opposite movements. So what it does, it restores the body part back to its anatomical position. So it increases that angle. So if you have your leg up and then you lower it back down, you've increased the angle. Okay. Same with the arm here. If you have it in a flexed position and then you put it back down, okay, you've increased that angle. Same with the head. Lateral flexion and hyperextension we have here. So lateral flexion, I'm showing you, of course, a picture here at the bottom of the little lady's head. She's moving it over towards the side. And then this lady here showing you the lateral trunk flexion, where she's taking the trunk of the body and just moving it towards the side. So this is movement of the trunk or head sideways to the right or the left at the waist. So lateral flexion is going to occur along the frontal plane, and it involves the intervertebral discs. Hyperextension, this is continuation of an extension beyond the normal extension. So if you bend the trunk backwards, that is going to be considered hyperextension. If you move the head backwards, and as is shown in this picture, that would be hyperextension. So you're moving that body part beyond the normal anatomical position. And then of course the legs, if your comes back, you're hyperextending it backwards. Okay. Also moving the palm backwards with the arm, of course in the wrist joint, moving it backwards, swinging the arm back would be another example of your hyperextension. Here is an animation on the elbow flexion and extension. It's just a really short visual to show you those in motion. I can't play those videos in this software where I'm using to record, so please go back into your PowerPoint in presentation mode and you should be able to play those. And here's an animation for you to watch later on the wrist flexion and extension. Okay, next we have the abduction and your adduction. Of course, these movements, abduction, I always tell people think of it as the body part is moving away. So the movement of a bone is going away from the midline. So it's moving the humerus laterally at a shoulder joint. So both abduction and adduction always refer to movements of the appendicular skeleton, not those of the axial skeleton. So just something to remember. The adduction, I always tell people to think of the bone is going towards the midline, or the movement of it is. So it's adding it back in. So adding it back to the body, adduction. So you have movement that returns the body part to the normal position from abduction. So if you look at this picture here, she moves her arm out or her leg away from the body, she's moving it away from the midline, so that would be abduction. When she puts it back to the body or back towards the midline, that's called adduction. Okay, here's a picture showing you adduction, abduction of the fingers. So when you're spreading the fingers or toes apart, you abduct them because they move away from that central digit. So bringing them back together constitutes adductions. So the fingers move towards or away from that middle finger. Toes move towards or away from that second toe. So that's example here of that picture. And again, you're seeing the difference here with the wrist moving it away. Be abduction, moving it back towards inwards would be adduction. Again, here is a video that you can watch on your PowerPoint later to show you those movements in motion. Circumduction, this is movement of a body part in a circle. So it's moving the humerus in a circle at the shoulder joint. It is a continuous sequence of flexion, abduction, adduction, and extension. And of course rotation as well too. So moving your arm as if, like this drawing here showing you that moving your arm as if you were drawing a big circle on the wall, that would be called circumduction. So in this movement your hand moves in a circle, but the arm does not rotate. If you look down here, we're giving you an example, of course, of your shoulder joint and also your hip joint. Both of those are ball and socket joints, which allows the circumduction movement. Okay, again, here is, of course, an animation on the humerus circumduction. You can watch that when you get a chance. Rotation, of course, this is where a bone revolves around its own longitudinal axis. So turning the head from side to side, as when you shake your head no, is showing you an example of that one. An example here, they're showing you that where the head side to side, the joint is going to be the lentoaxial joint. So when you have the head and trich rotation is usually described as right or left rotation, depending on the side that the rotation occurs on. So the limb rotation can be described as medial and lateral rotation. Rotation, of course, can also be described with reference to a figure in the anatomical position. Like this example here, rotation of the head occurs around the atlantoaxial joint, may involve the left rotation or the right rotation. Okay, when referring to the limbs, that describe the medial rotation is the first one. The other one we'll talk about in the next slide is lateral rotation. But it's internal or inward rotation. So anterior surface of a limb turns towards the long axis of the trunk. So it is turned towards the midline. So if you have your hand out here and then you move it inwards, you're turning it medial back to the anterior surface. If you also notice too, when the arm was out, the palm is showing. When she moves it back into her anterior surface of her trunk of the body, it's the outside of the hand is showing. And then of course the same with the leg, with the medial lateral rotation. Lateral rotation, of course, you had the anterior surface of a limb turns away from the midline or away from that long axis of the trunk. And again, it shows you an example, of course, of the arm going outward. This arm here, of course, it's outward instead of going medially. And so when it's lateral, you'll see the palm of the hand. Again, here is a brief little animation showing you the humerus rotation to watch when you have a moment. Special movements, these are going to be like elevation, depression, protraction, retraction, inversion, eversion, dorsiflexion, plantar flexion, supination, pronation, and opposition. This is an outline. The first one, again, these are going to be opposing pairs or opposing or opposite movements. So elevation and depression. Elevation is an upward movement of a body part, such as in if the mouth was open. When you close the mouth, that's called elevation because you're elevating the mandibular bone up. Its opposing movement is depression, so it's downward movement of a body part, such as opening the mouth. Another example of this, of course, would be shrugging the shoulders. Protraction and retraction. This protraction is referring to, of course, to move forward. So the movement of a body part is moved anteriorly, so it's moved forward. So again, she's taking her mandible bone and or her chin and moving it forward. Okay. Its opposing movement, of course, is retraction. So you take, of course, your mandible bone and you're moving it back to its normal position. Inversion and eversion. With these, of course, it is what they refer to a twisting motion of the foot. So inversion would be a twisting motion of the foot that turns the sole inward, so elevating the medial edge of the sole. So it is opposing movement is going to be eversion. So the movement of the sole is going to be laterally. Again, here is a short animation, of course, that you can watch later on the foot inversion and eversion. Just remember, inversion and eversion are going to both be referred to or pertain to the feet. Dorsiflexion, of course, and plantar flexion, both of these are going to pertain to the feet as well too. So dorsiflexion is bending of the foot at the ankle in an upward direction. Its opposing movement, of course, is the plantar flexion. So the person will be standing on their heels. So you can put heels here, standing on heels. The plantar flexion, of course, that is going to be bending of the foot at an ankle or in a downward direction, so they would be standing on their toes. So ballet dancers, of course, use the plantar flexion. They will either walk or dance on their toes or stand on their toes. Again, here's a short animation that shows you a visual of that. Supination and pronation, these are going to pertain to the arm. You have a movement of the forearm so that the palm is turned upward. It's opposing movement, of course, is pronation. When you have the forearm so that the palm is turned downward, that's going to be pronation. Again, here's a short animation you can watch when you have time. Okay, opposition, this is movement of the thumb in which the thumbs move across the palm to touch the tips of the fingers on the same hand. And it, of course, shows you an example of that where the thumb is touching the pinky. So opposition is that movement of the thumb towards the surface of the palm or the pads of the other fingers. The opposition movement enables you to like grasp and hold objects between the thumb and the palm. It also involves movement at that first metacarpal and the metacarpal phalangeal joint. So the flexion at the fifth metacarpophalangeal joint, of course, can assist this movement. Again, here is a quick, short little animation that you could watch to show the hand opposition. This, of course, is a table that was in a previous textbook we had used that showed a chart that kind of put it in a little bit of a chart form. So some people like the chart forms versus the PowerPoint slides, so I went ahead and left that in here. Checkpoint questions. Number 1, how do medial and lateral rotations are different or differ? Medial means the bone of the limb is turned towards the midline. Lateral rotation, the limb is turned away from the midline. Which movements requires movement of a bone away from the midline, usually the frontal plane. That's going to be abduction and lateral rotation. So both of those. Which movement requires movement of the trunk? Of course, in the frontal plane. So if you're moving the trunk sideways, so that would be lateral flexion. So it's going to involve the intervertebral discs. Okay, so this is the end of part 2.